So Naloxone, which is the generic brand name, there is a trade name known as Narcan, so you might hear it as both. It's actually a drug that is used to reverse opiate intoxication or overdose. It actually blocks the little receptors you have in your brain that those opiate medications attach to, and it takes the spot of it. It's actually a competitive blocker. So if there are opiates on that receptor, it will pull them off, and then it will take that spot so that it can't refill with opiates. And it's used to reverse overdoses or restore breathing in patients who are victims that have lost the ability to breathe because of the opiates they've taken. When law enforcement received this medication, they were given extensive training because that's not part of their daily job to give medications. So they received extensive training on how to give it, and they actually give it intranasally. So they aren't sticking needles into anybody. There's a little device that goes on the end of the syringe that atomizes the medication, and it hits the blood vessels in the nares and can get into the bloodstream that way.
How effective is it either way that it's administered?
This medication can be given, obviously, IV. It can be given intramuscularly and then intranasal, which is what we spoke about with law enforcement. It is effective in all three ways. It's just a little, obviously, IV is much quicker. You're looking at about 60-second to 90-second onset of effectiveness. IM is going to take, or intramuscularly is going to take about 5 minutes, and then intranasally is going to be in between those two, because that's your nose is very bad. If you've ever had a nosebleed, you know it's very vascular, so that's a really good route for giving that medication.
Even though they're not breathing, it'll still absorb into.
Even though they're not breathing, it will absorb into the bloodstream, and so I would say you're probably looking at maybe 2.5 minutes for the onset of Narcan intranasally. I think if you wanted to look at the number of times we have actually just administered Narcan throughout the years, we are seeing a slight decline each year in our reason for giving the medication. I think there are a lot of factors that play into that. You have the home prescriptions. They're identifying the fact that this might be an opiate overdose, and they're giving the appropriate medication for it, and they're following what they're supposed to do. You also have law enforcement that has it now. If they've already administered it, we may not have to re-administer it. So we mark what they did, and then we move forward with that. There are just a lot of factors that could play in that could give us that reason. I just think we could all safely say that we know as public that opiates aren't going away. I just think maybe public education might be getting a little bit better.